everybody, thanks for stopping by. We are going to jump right into a routine specifically for sciatica. So real quick, this should not make your symptoms worse, okay? Sciatica is something you definitely don't want to trigger. So if it's getting irritated, either back off the exercise or just stop completely. That doesn't mean you have to stop the whole thing. Just stop what you're doing. Make sure that what we're doing isn't going to irritate it, okay? Because that's just going to make it worse. The only thing that you'll need is actually a belt or possibly a long sheet close to you, and you're going to see why when we get there, okay? So we are going to start on our backs. So you're going to come down onto your back, have your legs hip distance apart with your feet flat, arms at your sides, and we're going to start with something that sounds very simple called pelvic tilts. So what you're going to do is curl your tailbone towards you. So all you've done is flattened your low back, and then rock your tailbone away from you. Okay, so you're going to curl it towards you so your low back flattens, and then tailbone away from you so you get this little space in your low back. So it's really gentle. It's not a very big movement. I don't want it up in the ribs at all. I don't want it down in the knees. I just want it right here. So I'll talk for a second as we do these about sciatica. Typically, the sciatic nerve is getting pinched somewhere. It usually will either be in the low back, in the lumbar sacral area when it leaves the spinal column, or sometimes it can also come in the piriformis, so a muscle itself can get tight and pinch on the sciatic nerve. The sciatic nerve is the biggest nerve in the body, and so that's why people tend to know that term, right? Once you've had sciatica, you don't forget it. It can be extremely painful. It could be symptoms simply pain in the butt. Literally, you might just have a little pain right in your butt cheek. You might have it running down your hamstring. You might get it all the way into your heel and the bottom of your foot. So all of those things could happen. Usually it's a stabbing kind of pain. It could be numbness or tingling. And it can happen for a variety of reasons. But what this little sequence is meant to do is to help loosen where the sciatic nerve is getting pinched. That is our goal with treatment, to calm it down and to start to relieve pressure on the nerve, okay? So think of it that way. This isn't something you're going to just push through and fight through and muscle through. This is something you want to be very gentle and loving with, and there's definitely things that we can do for treatment. All right, so those were your pelvic tilts, just nice and gentle, like I said. So we're going to take it into a bridge. So take your inhale. Now exhale, curl your tailbone again, and roll up into a bridge. One vertebrae at a time. That's the main goal with this. Okay, inhale at the top. Exhale, roll down one vertebrae at a time. Okay, and we'll continue like that. You inhale at the bottom to relax and release. You exhale to curl. And I really want you to focus on one backbone at a time. So I'm not doing this for glute and hamstring strength only. I'm really doing it to try to get some movement individually in your spine, all right? So we'll do a few like this. Now, sciatica is very common in pregnancy, I know. You wouldn't necessarily want to do this exercise late term in your pregnancy at all. You're not going to want to be on your back, right? So maybe I'll do another video for my pregnant friends and sciatica. So I do understand that, but if you'd like, just skip this part and you can do some of the other things that we'll be doing. Good. And then we'll roll back down. So feel free to do up to 10 repetitions of those if it feels good. All right, so come down, take a break. I'm going to have you hug your right knee into your chest, straighten your left leg out. So just give it a really good squeeze here. I'm going to loosen up the hip a little bit. And then we're going to go ahead into a gentle twist stretch. Hold on to the knee with your left hand. Your right hand goes to the side, and you're going to twist and look over to your right hand. Now, let me show you a modification. If that's too much, you just bring your knees together, drop them both, and look to the opposite side. So if you're in pain, this might be a better option for you. Okay, so either one. And once we're there, just hold it. And then let's come back to center. Okay, now keep this leg, and you're going to bring that belt or sheet close to you. All right, so these are called sciatic nerve glides, one of the best things you can do for yourself. So you're going to take that belt or sheet and put it right on the ball of your foot, almost to your toes. And then you're going to straighten that leg. Now, this is going to depend on your pain level and how tight your hamstrings are. You might have your leg way down here. You just need a longer sheet. Completely fine. I only want you to be able to keep your knee straight and not to have pain. Okay, so you're going to find that level for yourself. And then once you're there, you're just gently going to pull on this to bring your toes back towards you and then release and point. Just really gentle. And again, this is the one where I don't want any pain at all. And I would do between 10 and 20 of these, nice and gently like this. So what we're doing is we are gliding the sciatic nerve in its sheath from the toes all the way up to the lumbar spine. You don't want to stretch nerves, you want to glide nerves. So they have a sheath around them, kind of like electrical wires have a sheath around them, same idea. And the nerve can just glide in that sheath, and that's what we want. So think of this, I know I keep saying it, but I'm really going to harp on it, gentle. Because if you just crank on it, your body's not going to be happy. All right, good. And then hug that knee in again. And let's switch legs. So keep that close. And just hug the other knee in first. And then we'll do your twist. So either one, the single leg and over to the side. That's what it looks like from this side. Or just knees together, let them drop and look. Okay, so all of this is, what it's doing is trying to open these facet joints on the side of your spine to, again, kind of give it some relief. And it's going to help with that piriformis too. And either of those versions is fine. And then back up. Okay, right leg straightens out, left foot, and here we go. So again, up towards the ball of your foot. If it's on the heel, it's not going to help. So ball of your foot so that when you pull, you get some stretch, and then point. Inhaling and exhaling. So I'm really not pulling all that much on my belt here. I'm just kind of using gravity to do it, and then I point my foot away. And if you didn't want to count, you could just set a timer for a minute and just do this nice and slow. Don't go too fast. And we'll do one more on this side. Good. And then you can bring that down. All right, so we're going to set that to the side, and we're going to do one more stretch here on our backs. Bend both knees. Cross the right ankle over the left knee. Now, this might be enough stretch for you. If it is, stay here. If you have a little more room, you're going to reach and grab behind the thigh or on top of the shin. Either one is fine. So I'm reaching between, in that hole in my legs, to grab behind my thigh. And this is stretching that piriformis. And again, breathe. And then you can just gently switch legs, cross, and if you need more, pull the legs in. Good. And then you can release and go ahead and push, roll to your side. Push yourself up. I want to do one more stretch for a side stretch. And again, that's just meant to open up the facet joints on either side. So you have some options here. You can sit on a bench or a chair if that feels best to you. Just get yourself up on the ground and sit on that, and that's great. If you want the traditional Pilates exercise, which I like as well, this is called a Mermaid Stretch, and this is a Z sit. But if it bothers your knees or your hips, just sit up a little bit on a low bench, and that would be fine. And you can sit cross-legged as well. So arms come to the side, and we're going to reach up and over. And then you lift back to center and take it the other way. So inhale and exhale. Just make sure you're only going to the side. That means you're not leaning forward or backward. We say feel like you're moving between two panes of glass. Good, and then we'll just switch legs. If you're cross-legged, switch which ankle's on top. If you're sitting in a chair, you're just gonna do it again. Okay, same thing. So over, and we'll go to the side. So the main thing with sciatica, be patient with yourself, be patient with it. It can take a long time, I know. Try to find the cause. If you need to, I think physical therapy, as a physical therapist, I think it's a great option for sciatica. We help a lot of people. So don't be afraid to go that route. Check your movement patterns, good, and relax, and see if there's anything that you can change. And then do this routine every day. Just make sure it's not causing you any pain. And over time, that sciatica hopefully will get a little better for you. Thanks, and have a great day.